The wrist is a complex area capable of high degrees of movement and fine control. Subsequently, wrist pain can come on gradually due to a number of reasons. The Quervain's tenosynovitis is when tendons of the thumb become inflamed. Pain and swelling will be local to the back and outside part of the wrist and could extend both toward the elbow and toward the hand. Other tendons around the wrist can also become aggravated in a similar way with repetitive activities or loading, such as playing tennis or using work tools continuously. Bursitis is another common condition. Bursa are small sacs of fluid found in various parts of the body, which help reduce friction and help structure move freely. Bursa of the wrist, such as those found on the back and outside area of the wrist, can become inflamed and irritated due to consistent loading and overuse. These types of tendon or bursa aggravations are commonly managed by physiotherapists and occupational therapists. The aim is to reduce load through the area, manage symptoms, and gradually develop strength, conditioning, and return to function and activities. In more severe instances, you may need to be referred to a specialist for other interventions such as specialized splinting or a corticosteroid injection. Carpal tunnel syndrome is another commonly experienced issue of the wrist, where a nerve of the wrist is compressed. Symptoms experienced include burning pain of the palm and may include numbness of the first 3 fingers. These symptoms can be worse at night, and in some instances, pain can radiate to the forearm, elbow, or even up to the shoulder. Arthritis can also occur in the wrist, where the cartilage between joints become worn and damage occurs. Your GP, physiotherapist, and occupational therapist will be important in assisting you in managing and improving your symptoms, maximizing strength, conditioning, and joint health, and helping you return to function. Common injuries to the wrist occur due to falling onto an outstretched hand. This type of incident can cause various types of fractures, most commonly occurring in the bones of the forearm, such as the radius, or the smaller bones of the hand, such as the scaphoid. Also commonly injured in this way are ligament strains or ruptures. Ligaments are found in various areas of the wrist and hand, joining bones and functioning to provide stabilization to these joints. After an incident such as a fall onto the hand, mild pain which resolves after 1 to 3 days with a complete return to normal function will be considered no cause for concern. However, pain of higher intensity, significant swelling and bruising, and pain which lasts longer than a few days should be investigated by your doctor. Acute injuries of the wrist may be very painful at the location of the injury, with associated swelling and bruising. The acronym RISA is important in the first 12 to 24 hours. Rest the joint, limiting movement. Apply ice for 15 minutes every 2 hours to reduce swelling. Apply gentle compression, such as a compression bandage. Elevate the area above heart level to reduce the amount of pain and swelling. And refer by going to see your GP or physiotherapist for guidance and management. Mild strains or bruising may simply require rest and symptom management to encourage quick recovery. More significant injury to tendons or ligaments may require braces or splints to immobilize the area and ensure correct healing occurs. More serious injury, such as fracture or tendon or ligament rupture, may require more significant management, such as casting or in some instances, surgery. With all wrist injuries, your GP will guide you regarding the extent of the injury and the management that is required. Cases which require longer recovery can often benefit from rehabilitation provided by a physiotherapist or occupational therapist, as pain and immobilization can cause a loss in strength, range of motion, preventing you from returning to your daily activities. Rehabilitation can ensure you regain the strength and conditioning in your wrists, achieve greater movement and function, and return to the activities that you love. You will always be referred on to a specialist doctor by your GP, physiotherapist, or occupational therapist if required. For example, other assessments may be required, such as MRIs or X-rays. These are only used if a fracture is suspected, if the extent of your injury is unclear, or if further information is required in order to manage your rehabilitation. Another reason may be for a surgical opinion if it is deemed necessary.